just to confirm we're now live.
Thank you. So good morning and welcome to the Health and Wellbeing Board, the first virtual meeting of the board. I am Dr. Linda Colley, Chief Clinical Officer for Portsmouth CCG and Joint Chair of this board, and I'm chairing the meeting today. We are meeting virtually in response to the limitations placed on governance by the COVID-19 pandemic. Until recently, the law stated that all members had to be present in the room to make formal decisions at meetings. However, the law was amended in response to the COVID-19 emergency and councils are able to hold public meetings virtually. This will be in accordance with the local authorities Coronavirus Flexibility of Local Authority Meetings Regulations 2020 number 392 of the regulations. Members of the public are invited to view this meeting and there has been the opportunity for written representations to be submitted. This is a new experience for many participants and we will all need to exercise patience and understanding while we familiarise ourselves with the new arrangements. Board members are requested to keep their microphones on mute and to only turn these on when they are called to speak. If the chat function is to be used, it's best to just put your name, indicating to me that you wish to make a comment, and then I will invite you to make one, rather than putting any other comments on there because the public will not be able to see them. So it is important that we do just put your name and I will invite you to make your comment. It's probably easier if we stick to that rather than using that and the hands up function because it will be just make it easier for me to monitor. So please can I ask everyone taking part today to confirm that they are present. I will be doing this by asking people in turn and at that opportunity if you unmute your microphone and also take the opportunity to tell people who you are if you would wish to. So I'll start Matt Winnington.
Hi there, I'm Councillor Matthew Winnington. I'm the Cabinet Member Health, Wellbeing and Social Care at Portsmouth City Council and also the co-chair of the board, and I am present.
Thank you. Sorry, I didn't ask for apologies, did I first? Sorry. Should we, before we move on to everyone else who's present, can I just ask for the apologies as well, because some of them on my list are apologised. It will just save me going through twice.
Okay. I've received apologies from Sarah Beattie, Francis Mullen, Diane Sherlock, Stephen Lebetz, Mark Cubban, who's represented by Helen Bray, and Solent may be represented by Sue Harriman or Susanna Rosenberg, but we'll wait and see on that. Thank you.
So we also just got apologies from Gerald Vernon Jackson, who's struggling to join the meeting. Councillor Horton.
Good morning, everyone. Yeah, I'm Councillor Horton. I'm the Cabinet Member for Children, Families and Education.
Thank you. Has Matthew Atkins joined? No. Councillor Smythe? No. Ines Richins?
Good morning, I'm here. I'm the Chief of Health and Care, Portsmouth.
Nick Moore?
Yeah, I'm present. Nick Moore, I'm a GP on Portsmouth CCG.
Lovely. I believe it's Sue for Solent, Sue Harriman?
That's correct, Linda. Yes, thank you. Sue Harriman, Chief Exec, Solent NHS Trust, and I will need to leave the meeting at 11 o'clock, please.
Thank you. Alison Jeffrey.
Hello, yes, good morning, Alison Jeffrey, Director of Children, Families and Education for the City Council and present.
Jackie Powell.
Hello, I'm here, Jackie Powell, lay member for Portsmouth DC.
Steve Burridge.
Good morning, Steve Burridge, Hampshire Police District Commander for Portsmouth.
Thank you. Barbara Sawyer. Roger Batterbury.
Hello, I'm Roger Batterbury from Healthwatch Portsmouth and I'm present.
Thank you. Gordon Blum. Helen Bray.
Yes, Helen Bray from Portsmouth Hospitals Trust.
Helen Atkinson.
Hello,
Hey, I'm Helen Atkinson. I'm the Interim Director of Public Health and I'm present.
Sandy Thompson.
Good morning. Yeah, Sandy Thompson, Group Commander for Portsmouth for Hampshire Fire and Rescue Service.
Kelly Nash.
Hello, yes, I'm Kelly Nash from Portsmouth City Council Strategy Unit supporting the board.
Joanne Wildsmith.
Yes, I'm here from Democratic Services taking the minutes today.
Lovely. Is there anyone else that I've missed off the list that I haven't called to ask? Lovely, thank you. Can I ask if there's anyone who's got any declarations of interest for today's meeting? No, lovely. So we'll move on to the minutes of the previous meeting, which was held on the 5th of February. Have we got any comments?
Sorry, can I report Judith Smythe was going to make a comment. Councillor Smythe was going to suggest an amendment at minute 21, paragraph 3. Dr. Williams is grateful for the support of the CCG and it should say public health.
Okay. Do we have a proposer for approval of the minutes as amended?
Happy to propose.
Lovely. And do we have a seconder?
I'll second.
Lovely. The recommendation has been proposed and seconded. I will now take the vote by affirmation of the meeting as permitted within the regulations. If there is no dissent, the proposal is passed. Are there any objectors to this recommendation? No. Lovely, thank you. So the minutes have therefore been approved and will be amended accordingly. So we move on to the main item of the agenda today, so local outbreak planning, and I'll hand over, I believe, to Helen in the first instance, and Kelly will be supporting.
Thank you, Chair. So I'd just like to take you through the paper, the purpose of which is to update the Health and Wellbeing Board on the new requirements for local outbreak plans in response to the COVID-19 pandemic, and to make recommendations on how the local governance for this process will be configured in Portsmouth. So just by way of background, on the 22nd of May, the government announced the requirement for local outbreak control plans to be developed at upper tier local authority, and the focus of this is to reduce the local spread of infection for the, of COVID-19. So also the recommendation is to have established a member-led COVID-19 engagement board for each upper tier local authority, and our proposal is that that will be a working group of the Health and Wellbeing Board in Portsmouth, and the focus to communicate with the general public and our residents. So this will be supported by an officer-led health protection board, which is also connected in terms, or the recommendation is for the governance to be connected into the local resilience forum command structures that we're already working within in Portsmouth as part of the Hampshire and Isle of Wight local resilience forum, and have been for some months in a major incident mode. There's also a 300 million funding offer to upper tier local authorities, which was accompanied to this announcement. So the obvious main objective of having local outbreak plans are to ensure that as the national government relax the lockdown and the restrictions on our population, we need to have mitigating actions in place at a local level to ensure that we keep the reproduction rate, which, as you'll know from the national PM announcements with the Chief Medical Officer, have to be kept at around 1 or below to ensure that we are reducing the spread of infection. So really these local outbreak plans are really being put in place to mitigate against those changes as we ensure that we can return to life as normal as we can in these difficult times, and for as many people as possible, in a way that is both safe but protects our health and care systems, but also saves lives. So the local plans, the guidance we've been given are that we need to develop local plans that cover 7 key areas. And it's important to say, and I'll quickly go through the 7 areas, that the work that we are undertaking currently is already underway. A lot of this work is already in place, underway, but then we are ensuring that through the outbreak planning that we're ensuring it's coordinated and comes together, and we are putting everything that needs to be put in place. So the number 1 area priority is around ensuring that we both prevent but also manage effectively outbreaks in care homes and schools. The second area is around ensuring the same, in that we are managing other high risk settings and locations, which could include, for instance, sheltered housing, transport access points, ports, as well as the work we are doing with our homeless and lost sleepers in the hotel. So that is the second area. The third area is ensuring that we have got the robust local testing processes and plans in place. And we in Portsmouth are working across the whole of the Hampshire and Isle of Wight Local Resilience Forum patch in terms of our local testing provision, and recommending that we continue to do that. The fourth area is around ensuring that we are part of the local, regional and national test and trace programme, which I'll come back to. And then number 5 is around ensuring that we have the most up-to-date access to and are using the national and local intelligence. So it's how we will, and many of you heard of the biosecurity, the Joint Biosecurity Centre, the JBC, where we are receiving a lot of our intelligence around confirmed cases, but also the local intelligence that we have been working very effectively in Hampshire and Isle of Wight through the LRF modelling cell, to ensure that we are updating both the organisations within the LRF as well as our residents and the public. And we continue to bring all of that local intelligence around confirmed cases, laboratory results for testing together, and have as much information as we can in terms of understanding our local infection rates. The 6th is ensuring, and these are not in any specific order, it's important to say, but it's continuing to support our most vulnerable residents in our communities. And the additional bit within this expectation is around how we support people who don't have access to family or other community links around self-isolating. So ensuring that we are providing the ability through the Hive in Portsmouth, which is our proposal, to ensure that people can get food parcels, pharmacy, access to their medications, etc. But also it is around the overall work that we've been doing for some time around ensuring that we are supporting our most vulnerable residents through the pandemic. Then the final bit, which we'll come back to, and I'll pass to Kelly, which is establishing the governance structures around how we make decisions, how we are ensuring or really assuring the outbreak plans that we're putting in place are robust and meeting the needs of our residents. So we have to produce these outbreak plans by the end of June, and we are doing so at every upper tier local authorities. So even though we are working as a local resilience forum across the 4 upper tier local authorities in Hampshire and Isle of Wight, there will be an outbreak plan at each of those 4 areas working locally. But we are continuing to work particularly around our intelligence and our testing across the whole of the Hampshire and Isle of Wight. And we will ensure that the 4 outbreak plans are, because obviously we've got borders, are in line and both meeting the needs of our local residents, but also meeting the needs of the whole population of the LRF. So there is, in terms of going back quickly to the test and trace, which I know many people are aware of, and there has been a lot of national media coverage. It went live on the 26th of May, and it is both a national, regional and local service, and we are part of that service provision in terms of how we manage cases locally. So there is a National Outbreak Control Plan Advisory Board, which is led by Tom Warden, who is the Chief Exec of Leeds City Council. And then there is also a Regional Assurance Board in place at the South East region. but we obviously are ensuring that we are leading the development, assurance and delivery of each of our local outbreak plans at our local level through this governance. So contact tracing, just to say, there are several, there's 3 tiers, but I just want to put into context. You'll be aware that there is a NHSX COVID-19 app, which has been piloted in this patch, actually, in the Isle of Wight, and that is due to go live at the end of this month, is the current government announcement. But that doesn't just mean to say that Test and Trace has to wait for that app to go live, so it's already up and running, and there is the ability for every resident who is symptomatic with COVID-19 symptoms that they can contact either through a website or through a telephone the National Contact Tracing Service, which is the next element. There are 25,000 staff in the National Contact Tracing Service, and that's tier 3, and they deal with what we call the least complex cases. So those that are quite standard in terms of both symptoms and contacts, and each of those residents all over the country are offered to have a COVID-19 test, and that's a home test kit, or they can access local testing and they will get the results, and then call handlers who are supported, importantly, by 3,000 specialist trained health protection contact tracers who are used to doing contact tracing regularly. So there is that support in terms of both nationally, regionally and locally in terms of that expertise. So then contacts are followed up for all of those people. Now, it's important to note, obviously, this is the mitigating action. As we come out of lockdown, we are encouraging people who are symptomatic to stay at home, self-isolate for 7 days, and their contacts, particularly household contacts and close contacts, to self-isolate for 14 days. Then the next tier is that regional expert support, and then what is the tier 1 is what we are delivering at a local level. So that is what we call the more complex contact tracing, which will be led by our local Public Health England health protection teams, with support by local authority, public health teams and other colleagues in the council. And this is around those 7 areas I talked about above, but more importantly, the complex contacts, whether you are in a homeless hotel hostel, a school, a care home, etc. So those particularly more complex contact tracing and outbreaks will be managed at a local level. So I think I've really covered in terms of the detail. So I'm going to pass on now to Kelly, who's going to take us through the proposals around the governance of the 2 boards that I mentioned. So over to Kelly.
Sorry, Kelly, before we do that, can we just formally welcome Councillor Vernon Jackson to the meeting, who has joined us. Thank you, Kelly.
Thank you very much. I'm sorry, IT issues with Teams as per normal.
So we're up to Kelly. Thank you.
Thank you, Dr. Coddy and Helen. Appended to the report are 2 sets of terms of reference for the governance structures that we need to put in place to support the processes that Helen outlined earlier. The first is for a local health protection board, which is broadly an officer level group who will take the necessary actions and formulate the recommendations for the local oversight and engagement board to ratify, and we'll come on to that shortly. It's important to recognise that for most of the things that will need to happen, the statutory powers are already invested in the relevant officers to take those actions. So in many cases, they'll just be applying their operational and standard operating procedures and taking the steps that they need to take. But they'll be doing that in the framework of the wider plan, and obviously with accountability through the wider governance structures. The guidance requires that local governance is provided through the Health and Wellbeing Board. Obviously, our Health and Wellbeing Board is quite extensive in membership and has a wider system emphasis to it. We felt that possibly that wasn't helpful to bring together for this very specific purpose, And also because we don't know how often it's necessarily going to need to be convened, or expecting monthly to begin with, but it may be more and it may be less. We'll have to see how things go as things develop. It would make sense to establish a subcommittee of the Health and Wellbeing Board to provide that oversight, which we're terming the Local Engagement and Oversight Board, and you have the terms of reference proposed for that board at Appendix 2. And again, this is very much to provide that oversight and assurance of the actions of the Local Health Protection Board to make sure that they feel coherent as a whole set of actions, that they chime with what we feel the local community needs, and generally make sure that things like grant conditions are being complied with. So a broad oversight role for that board, but a particular role to actually ensure that all actions being taken feel like they are appropriate for the communities which those representatives serve. I think what we're asking for today is general agreement to those terms of reference. Obviously, if there are particular tweaks that people want to make, now's the opportunity to make them. We're very happy to do so. And also to recognise that the membership of the Local Engagement Board has yet to be set. It is intended to be a member-led board, so the proposal is that that is half elected members and half other members drawn potentially from the Health and Wellbeing Board or potentially from a wider membership. There are some suggested posts already there, so as well as the 6 elected members, it's suggested that Helen is part of that board, Dr. Colley, a representative from the Hive and a representative from Health Watch, and I believe Roger's agreed to perform that function. There are 2 additional posts that we maybe just need to think about how we would fill that to make sure that it provides the function we need it to provide. And I think that's all I'll say at this point, but happy to ask questions as part of the wider discussion. Thank you.
Thank you, Helen and Kelly. So I'm going to open up to questions. If you could put your name in the chat box if you wish to raise a question, and then we can come to you in turn. Firstly, I think Councillor Winnington wants to ask some questions or make some comments.
Yeah, thank you. And thank you, Kelly. Thank you, Helen. Yeah, I've just got to say, I'm just proposing a couple of amendments to the terms of reference. This is on reflection. I've discussed these in advance with Kelly, but it's just one of the things I was a little bit concerned about in the bullet points in the terms of reference for the member-led engagement board was just around the resource allocation bullet points, because I thought it was just important to be clear that the member-led engagement board doesn't have fiduciary powers. So when we're talking about the allocation of resources, there's no powers within that particular board to make to say we need to spend money from the council's budget on such and such. So, the amendments has already been shared with Dr. Colley, Joe Wildsmith, and Helen as the Director of Public Health. I'll just read it out. So the bullet points about the resource allocation would now read: ensuring that recommendations from the Health Protection Board for allocation of grant resources that support the effective delivery of the plan comply with the conditions of grant funding and are affordable within the grant allocation. Monitoring the expenditure incurred in implementing the plans to ensure it remains affordable within the grant allocation, and identifying where representations may be required to funding organisations for further resource if this is required. So, so it just makes it really clear that the members-led engagement board really just is monitoring the work of the Health Protection Board and the outbreak plan, and recognising that if there were any difficulties in delivering that plan, then that would have the opportunity to go elsewhere to the funding bodies, either the council or the CCG, to say we actually need extra funding to make sure that this can be done properly. But hopefully that won't happen, and that it will all come within the realms of the funding allocation we have. The other one was on the allocation of the 2 last the two last membership bits of the member-led engagement boards, because at the moment, and there's a slight amendment to the terms of reference there as well. So I would ask if we can amend the terms of reference. I can't. So it's where it says the two last members will be made up from membership of the Health and Wellbeing boards. I actually want that amended so that it takes out about they have to be members of the Health and Wellbeing boards, because as this is a subcommittee of the boards but has membership already from outside the membership boards, I would like to suggest that we have as the last two members, together with the Director of Public Health, the Accountable Officer of the CCG, Health Watch and the Hive, that we have the last two being from the Portsmouth Education Partnership, someone from there, which means that education is tied into it, and they are a member of the board already. And the second one I would like, and they're not a member of the board, is someone from Shaping, which means that we have the input of the business community into that board. So so we would just need to amend the terms of reference to take out mention that they have to be a membership or a member or a membership organisation in the board already. But I think then that covers the entire scope of all of Portsmouth, really, from the members who obviously are we are representatives of the community, and we have all our community links in the very widest sense, and then all the other parts, the voluntary community sector, the NHS, public health, and therefore the council, but yeah, and Health Watch as a representative of patients, are all covered by the membership of the board. So those are my two amendments I'd like to make today.
Lovely, thank you. Joanne, you've put on a comment. Oh, you're on mute.
Apologies. Yes, I was just going to say we had the written comment of Steve Lebetz, who didn't have specific comment other than ensuring that the schools are kept on board and in the loop and listened to by the board. So I'm sure that's covered by that amendment.
Any questions or comments? Jackie?
Sorry, I didn't know how to put my name in the box.
Don't worry.
Fine. It was just a general comment about the capacity that we'll have within Portsmouth to do the complex contact tracing, and be able to get reports and get people's results back within a sensible and minimal time frame. And I don't know where we were quite sitting with that.
Shall I reply to that? Thank you. So the capacity to do the more complex contact tracing will be at present within existing resources, both in the local health protection team. Now they have also across the region taken on an additional 60 members of staff. That is across the whole region. So our local health protection team cover Hampshire, Portsmouth, Southampton and the Isle of Wight. And then obviously we'll continue with the officers and staff who are already managing some of the more complex outbreaks. So I'll give you an example, which will also perhaps respond to the schools question as well that we've just had. So we already have work in place within the CCG and Innis's adult social care team and public health around how we manage outbreaks in care homes. And we have also from Solent infection prevention control input from the Solent Trust as well, as an example. And we also and we have a weekly group where we a weekly meeting, as well as obviously ad hoc other meetings during the day where we are actually identifying where we've got concerns or risks in care homes, and following up in terms of whether it is whole care home testing that's needed, or infection prevention, control training or support. And then the same process we have with schools. So Alison Jeffrey is on the call, leads a return to schools work programme with her team, and we have an infection prevention, control and health and safety group, a subgroup of that group with head teachers represented, where we deal with any concerns and around school outbreaks. But it's really important to put into context that we have been and continue to ensure that we're doing planning and risk assessments to ensure that every school, every care home has plans in place, but also is clear of the processes. We are continuing that work also with other high-risk settings like our homeless hostels, and that's really the important part of the outbreak planning, so that we have both the plans in place, but also importantly, the relationships and the understanding of who needs to contact who when there is a presumed possible case or confirmed case. And then in terms of testing, we don't have complete control, obviously, on the testing process, but as we move forward, government have announced that the control of testing will move more over to local arrangements under Directors of Public Health. So we are using, obviously, the national testing programmes and pillars currently, and there is a commitment by government that there is a return on results within 24 hours. But we know there is variation in that, and there are different testing pillars. So there's whole care home testing, which is led by Department of Health and Social Care. Then there is obviously local testing arrangements for NHS staff within the NHS and our local acute trust, as well as other programmes coming online like antibody testing. But there is a commitment, but I think it's fair to say that we know there is some variation. But as a whole, because we do get data on this, most are meeting requirements, but we do know that there are some delays. And of course, as we go into test and trace, it is mainly because obviously the whole point of it is trying to identify people with symptoms to stay at home. So it's home testing. But again, we're told that the home testing returns are within the 24 to 48 hour period. So I think it's important that we get that intelligence, because for me, that's part of how we're ensuring those outbreak plans. So as part of the work of the Health Protection Board, it will be not only the planning with organisations and settings, but it will also be ensuring that we are pulling all of that intelligence together, both local and national, to be assuring the member-led engagement board and therefore our residents that all of those processes are in place. And part of that is how we've just been talking as an example to Alison recently about what information we can make around school outbreaks available to both obviously parents, teachers, schools and the rest of the residents. It's really important, I think, as this planning which has been in place in terms of local leadership, that we start to really be able to engage with our residents and provide that information and assurance back. I think that's really key. Can I just say, though, it's my opportunity, because I do get the chance in answering your question. I would like to point out that currently that we are ranked 135th out of 150 upper tier local authorities in terms of our infection rate. And currently, as of today, we have got 324 confirmed cases, of which it's 150.6 per 100,000 of our residents. So that's putting it against a comparator that across the southeast region, it's about 245 per 100,000 residents, and we are the sixth lowest region in the country. So I just want to put that context. It's really important that we are in a good place in terms of infection rates in Portsmouth. And actually, all of this work for me is about how we lead together across, public services, voluntary sector, and obviously working with our residents to keep it low, the rates low, which is what all of this work is about.
Sounds wonderful. Hopefully we can keep that and keep it low. Have you got the same level of confidence regarding, say, the ports or the BME community? Do we need to put in anything extra to support those areas?
Again, another good question. So they are both, those areas are within the outbreak planning. So ports are part of, we will have to have in place, and we already have in place, regulations and plans around ports and people, new arrivals. And then there's obviously, there has been an increasing evidence base around the impact in our BAME communities and BAME staff in health and care settings. Just last week, there was a piece of work that PHE published that Professor Kevin Benton led on around that exact impact. And part of the work we've been doing is to ensure that we have appropriate risk assessments for staffing, but also are actually looking at our BAME communities as part of our inequalities. It's fair to say that we know one of the problems is it's getting the data. So at the moment, what we aren't getting is data on confirmed cases, that level of intelligence in terms of understanding. We get age and sex breakdown, but we aren't getting ethnicity. But for me, what we are seeing in the COVID-19 pandemic is what I would call an escalation of health inequalities. So we know those that are most vulnerable often do worse. And actually what we've got to do, which is what we're planning and putting in place in the outbreak plans, is how can we mitigate against widening inequalities, which we are seeing. So, you know, this is one of the issues that Alison talks about often. You know, we need to get our most vulnerable children back into school safely because they have, you know, a greater need. And how do we do that safely? And so for me, it's all of these outbreak plans are being put in place to ensure that we are both saving lives, reducing the risk of infection, but also targeting and supporting our most vulnerable communities.
Thank you ever so much. Appreciate it.
Thank you. So Councillor Vernon Jackson would like just to clarify something, and then we'll be moving to Alison Jeffrey for her comments. Councillor Vernon Jackson, over to you.
Oh, Linda, I think Gerald missed the bit at the beginning of the meeting about how you can't ask for things in comments because it's not known in public. So you know, his question was to Helen, could you give the figures for infection rates per upper tier councils again? So it might be helpful if Helen just restated those.
Happy to do so. I was just actually writing, but I'm not a very fast writer.
You can't do that because it's not in public.
Yeah.
No. Apologies. Yeah. Yes. So Portsmouth are currently, we have 150.6 cumulative confirmed cases per 100,000. That's compared to the southeast, which is 245 confirmed cases per 100,000. But if we just take our local area, Hampshire has got 245.4 confirmed cases per 100,000. Southampton 239.3 per 100,000, and the Isle of Wight 142.7 per 100,000. So
Helen, sorry, I'm trying to get back into this machine is ludicrous. It was the ranking I was after.
Yes, so we're currently 100 in terms of upper tier local authorities. We are ranked 135th out of the 150 upper tier local authorities.
Lovely, thank you. Over to Alison.
Thanks very much, Chair. I just wanted to say I completely understand the thinking behind the amendment of wanting to make sure that the Portsmouth Education Partnership is represented on the Health Protection Board. It may be possible to get one of our head teachers to attend those calls, but I really just wanted to reassure the board that, as Helen has explained, we have really good routes through to schools through the working group that we've established and the infection prevention subgroup, which has head teachers on it, and Helen is using that group to inform the work of the board, and also my directorate is represented on the board, so that if we didn't get attendance from the Portsmouth Education Partnership at every meeting, there are plenty of other opportunities for us to make sure schools are in the loop. And just an observation that schools are very keen to have the information about the infection levels in the city, not just in terms of numbers of outbreaks among schools, of which there are none so far, but actually the kind of information that Helen's just put out. And I know people are working on a public-facing depository for local information, but also I understand that the Local Governments Association's LG Inform database is actually publicly available and does give you nice diagrams showing little charts showing comparisons between local authorities where they are on the distribution, which is really helpful.
Thank you. Ines, you wanted to comment.
Thank you. It was just to say I'm entirely supportive of this, and Helen has been working through the thinking of this with me. And as Helen's already outlined, there's good connections into the wider care sector resilience work and plan that we are working on between the NHS and the local authorities. So I'm very confident it will all connect very well. So I'm entirely supportive of it.
Thank you. Councillor Winnington.
Yeah, just picking on Alison's comments, and yeah, thank you for all the work that's been going on with the schools. It's been absolutely fantastic, and I know working alongside Helen and with Susie as well at this very difficult time for them. It's just to clarify, it's not the Health Protection Board that they would have membership on. It would be the member-led engagement boards, which yeah, and the whole thing about that is it's very much the it's looking at things in a different way, the member-led engagement board, which is to sort of have those conversations for the community as a whole and really to do it in those ways. So it's just to make it clear that it's the member-led engagement board and not the Health Protection Board that we were looking to.
Apologies, yeah.
Okay. That's all right. No, it's there's so many boards around now. It's very easy to get confused. They could have called something different rather than saying it's a board here, a board there, and it comes under the Health and Wellbeing Board. It just makes it more confusing.
Thank you. Helen Atkinson, you had your hand raised a second ago.
Yes, I just wanted to mention, because I forgot to mention it earlier, particularly because we've got obviously Sue and Helen on the call. I sit on the daily NHS regional call, so just wanted to mention that we, obviously the NHS and individual trusts will be both developing their own outbreak plans, but through this engagement board, sorry, not the engagement board, apologies, the Health Protection Board, we have asked Sue and Mark to provide representation onto the Health Protection Board locally from the acute and the community trust, because it's also important how we work together across the NHS, because obviously hospitals, community trusts, GP surgeries are also part of communities, as are schools, as are other settings. It's important that we work together, and I think that's going to be crucial. So, you know, outbreaks in hospitals will be connected obviously to communities, because it's communities where staff work, it's communities where patients come from. So I think that's just really important that we say that this is all joined up. And I have to say, having arrived in, I know I say this quite often, but having arrived in Portsmouth only in February, I'm incredibly impressed, having come from working in London and other areas in the region, at the integration and integrated and joint working in health and care and all public sector in Portsmouth and Hampshire and Isle of Wight. It's very impressive.
Thank you. Any more questions or comments? No? So as the Health and Wellbeing Board, we were asked to agree the proposals for a local health protection board and the terms of reference. Are we all agreeing to that? I don't know, is it best to put any dissent by raise of hand, or?
Linda, just to remind, obviously I've got an amendment, so we need to approve.
Amendment, yeah. Does everyone agree the amendment? Was that, sorry, which, I'm just getting confused now with which one we were amending. We were amending the oversight board.
Yeah, the member-led local engagement.
Yeah, so that's the next one. Yeah. So the first one was for the Local Health Protection Board and the terms of reference. Are we all happy with that one? If you're not, put your name in a comment and we can come round to it. Okay, so then the next one was we were asked to agree the proposals for a local engagement and oversight board and the terms of reference, and that's the one where some amendments have been suggested. Are we happy? Do we need any more discussion about that one? No. And then there was the membership for the local engagement and oversight board as a specific action in itself that we need to agree. Are we all happy that the membership as recommended is agreed? Do we need, is anyone missing? Does anyone feel that anyone else should be invited? No, so we all seem to have come to a consensus about the papers. So am I correct? I'm going to just check for clarity now that we don't need to do a formal voting system because we seem to have agreed by consensus. I've got nods. Lovely. Thank you very much. And thank you for the time that's gone into developing that. So that was all that we've got at the moment for this meeting. So I can call a meeting to close unless there is anything that anyone else wants to raise. No? Thank you for your patience with this first virtual meeting. I'm sure we'll get slicker as we move forward. If you do have any comments about how the meeting has been run and could you feed it back to Joanne and we can try and incorporate it for the next meeting. Okay, thank you all for your time.
Thank you, well done, Linda.
Okay,
bye.
Thank you, Linda.